Hi, this is Dr. Toby, your host on Health and Wellness. Thank you for joining us. Don't touch that dial. We have a great show with Dr. Meredith Travelstead. Dr. Meredith is a obstetrics gynecologist at the Baptist Hospital. She's a board certified in obesity, obstetrics and gynecology, and she's been practicing now for at least 21 years. But she's not just an obstetrician. She's a Christian. She's a encourager. She's a teacher. She's a she's a wife to her husband Joel. She's a mother to three sons, and she's a leader in the Christian community in Jackson. We're so privileged and honored to have her on the show with us to share her faith journey through this last 20, 30 years. You're welcome on the show.
Thank
God
you.
bless you. You never ask a woman her age, but I know you said you gave your life at 10, so I'm going to say you've been on this faith journey for 30 years, possibly at least 30 years. But don't
Maybe
tell me how.
41.
Maybe 40. We don't want to ask her age, but yeah. So what a blessing you've been so far on the show, telling us how you and Joel met and how he had that occasion in 2014 that was a life-changing moment for both of you. Just wanted to ask a few questions about your faith in addition. You told us about your pastor and how he was a role model in your younger days. Was there any role models for you in obstetrics as a provider, as a physician growing up? Did you have somebody who helped you as a pace setter, as a pathfinder, if I may use the word, when you came out on your own out of residency?
Sure.
And if I may ask, I heard this recently. They said earlier on in the days, in the 80s, 90s, 2000, it was a predominantly male field, obstetrics.
Sure, yes.
So
It has changed.
when you went to residency, was it more females or more males?
More males.
Now it's more females.
Definitely.
Now it's 90% female.
Definitely.
Wow.
Just how medicine in general, there are more and more females, but specifically our specialty has become female dominated. When I always say there were 6 residents per class when I was in residency, and when I was there, there were 4 men and 2 women, just about in each class. Not by design, but that's just about how it was in the ratio. Now there are very few men, if any, in each level, in each class,
Yeah, we
and
have two at UMC right now in the whole 4 years. Yeah.
in the whole 4 years. So I think that that's more a reflection on women being drawn to a women's patients field, and then also patients recognizing and desiring to have a female in that specific private area of their lives.
When you did the residency, what drew you to obstetrics? Let me ask.
Well, when I was growing up, as I mentioned before, my father was an oral surgeon, so I really liked the surgery and the blood and guts, and I thought I wanted to do some kind of surgery, working with your hands and solving problems that way. And I followed even general surgeons around, and so this is along the mentoring idea too. My father first, and then other surgeons. And so when I went to medical school, I thought surgery was what I really liked. That
Wow.
was like blood and guts, and I was
Was he
always
at
interested.
UMC or he was in his own private practice?
He was in private
Oh
practice, and
wow.
he actually trained in Charity Hospital in Louisiana, in New
Oh.
Orleans. The old Charity
Yeah,
Hospital. So
very
they
old.
had a
Yeah.
lot of trauma and
Yeah.
jaw fractures. He would talk about barroom brawls and said fixing
Said it.
the jaw after that. And I just thought that was so neat. And he would bring home pictures and of cases he would do,
Oh
and
wow.
I thought that was just so neat. So that was a mentor and encouragement and interest, and then followed people around. And then when I got to residency, medical school, you do the 2 years of didactic, and then you do the clinical 2 years. When you get to your third year, you do the rotations, and get to really see. And I would encourage students now, as I do, keep your open mind as you go through each rotation. Could I do this? Could I be this kind of physician? Psychiatry, pediatrician, family practice, internal medicine. So I did always like the surgical specialties and subspecialties, but when I got to OBGYN, I thought, wow, this is incredible. A birth of a baby. People say all the time, do you ever get tired of this? I never get tired of it because it's a wonderful experience. It's a treasured moment in people's lives, and you get to be a part of that every time.
Mm-hmm.
I will be out in public, and someone will come up and say, "This is,
You delivered
Sammy,
this.
and you delivered this baby, and this was the first person who touched you."
And your husband
And
is
the
just
child is
watching, right? Your
like,
husband is just watching while that's going on. He's like,
right.
I've seen this so many times.
Well, 21 years of practice, it has happened a few times. But it is a joy. It's a joy. It's a precious time to be a part of someone's life.
Mm-hmm.
And then I still get to do a lot of surgery,
Mm-hmm.
hysterectomies, and laparoscopies, and all kinds of surgery. And then I also get to have that, like you have, relationship with your patients
Mm-hmm.
year after year, visit after visit. You get to know their family. Some patients, I'm delivering their babies, and I had seen them since they were teenagers. And so to me, that continuity of care is something you don't get with
So
other surgical
important.
specialties.
Right.
So it's the best of everything.
Mm-hmm.
As far as mentors, in residency, Dr. Jim Martin, who's now with the Lord, who was a strong
Oh,
Christian,
awesome.
and obstetric gynecology staff, and he was even the president of our National American College of OBGYNs. He
You mean the ACOG? Oh,
ACOG,
okay.
yes. He was so kind and
Was he a
loving.
UMC or Baptist or St.
UMC.
Dominic? Oh, okay.
Yes, he was my attending, one of my attendings who was
Mm-hmm.
a good mentor. And he knew my dad, and he took special care,
Mm-hmm.
and connection and guidance. And I just really respected him a lot. And then you may know I interviewed Dr. Helen Barnes. She
Yeah.
was the first African American OBGYN in
Obstetrician.
the state of Mississippi. And
So she
she's
interviewed you.
inspiring. She was my attending. She was one
Oh,
of
okay.
my mentors, I would
Right,
say.
right.
And
Okay.
then I have to say, my partners at the Woman's Clinic, I won't even list them all, but they have been so instrumental in
Oh, wow.
growing me up and mentoring me and giving me guidance, advice, and how to practice, how to take
Hmm.
good care of patients. And
And of course, as an OBGYN, you still refer to like reproductive endocrinology,
right,
GYN oncology.
right, right.
What other specialties can an obstetrician go into? I know there's GYN oncology, there's reproductive endocrinology. Are there other fields that GYN can choose to if she
Sure.
wants to?
Yes, and you've hit them. Four main ones, I would say. We do our medical school training,
4 years,
4 years, and then we do our residency, four
four
years.
years.
Then you can do a fellowship, which
Hmm.
gives you a super specialized career. So that would be gynecologic oncology, that's female cancers. Then you would have reproductive endocrinology, which is infertility and
Hmm.
fertility issues. And then you could do maternal fetal medicine, which
Hmm.
is high risk obstetrics,
Obstetric.
but more as a consultant. They
Right.
usually don't do deliveries. They're a
Delivery.
consultant for me with high risk patients.
Okay.
And then there's an evolving specialty called urogynecology.
Oh yeah.
They're trying to get board,
Hmm.
accreditation for a fellowship, but that's
Most of those fellowships are for 2, 3 years,
two or
really.
three
Okay.
years, I think 3 years.
Interesting. Now, just as a passive, you didn't want to do any of that when you finished.
I liked the
Oh,
generalist,
you like the
meaning I
general.
like to do, I wouldn't want to pigeonhole into one
Hmm.
area. I like to do, and honestly, as a referring physician, I do a lot of what they
What
do,
they do,
the
right?
first steps of what they do.
Right, right, right.
So you do see a lot of a whole wide range of things.
But you wanted the patient contact.
The patient
Right.
contact,
Tell
yes.
us a bit about the latest statistics show that Mississippi is number one chlamydia, number one gonorrhea,
Mm.
number five for congenital syphilis, and then number eight for HIV, and I think number five again for regular syphilis. So what I call it 1158:
Mm.
syphilis, gonorrhea, chlamydia, HIV. We're in the top five. So the question is this: as a obstetrician at the forefront of seeing women and taking care of their babies, give us some counsel on what is the danger of STDs like syphilis and gonorrhea and chlamydia on our pregnant women, and what can you as an obstetrician do to help change this? And the reason I'm bringing this up is because Mississippi is number one, Louisiana is a close number two. So you're
Sure.
talking to the audience here. You're preaching to people who may know somebody who needs to get this counsel. So what do you recommend
So the
to reduce
dangers
this?
and how to
Mm,
reduce. So sure, the dangers. First of even getting pregnant, you have risk of pelvic inflammatory disease from these infections that can affect your fallopian tubes and cause scar tissue and blockage and prevent pregnancy from even happening. And then you can have complications related to if you had a pelvic abscess. I actually had one this week, a pelvic abscess, where it can affect you losing a tube, losing an ovary, losing a uterus, and cause a lot of scar tissue even before you get pregnant. And then, as you mentioned, syphilis can cause congenital syphilis. It can
mm.
affect a child in utero, so you can actually pass on those infections to the
And a
children.
high risk of losing the pregnancy, right?
Right.
If you have any of this.
Yes.
And in fact, it reduces your chances of fertility, from what I've heard, if
Right.
you have the STIs
Right.
repeatedly.
Yes.
So what do you think we can do to reduce this in our community? And of course, it's a two-edged sword. It's the boys and the girls. So when we're speaking to both sexes, not
That's
just the
right.
females.
That's right.
So what can the community do as a whole to reduce the? And what amazes me is that we live in the Bible Belt and we are number one. You would think it would be Florida or California or New York, or Las Vegas, but it's Mississippi and Louisiana.
That's right.
So what on earth is going on in our Bible Belt communities here?
Well, I say, how do you get sexually transmitted diseases? That's a rhetorical question.
Okay.
How do you get sexually transmitted diseases? You get them by sexual contact. And I say it to be silly, but also just to drive the point home. Your sexual activity, your high risk behavior, your multiple sexual partners put you at risk of having these sexually transmitted diseases. So,
Now you have to define multiple, because some people two is normal, three maybe is a crowd. Well, as a physician, how do you define multiple sexual partners?
more than one
Okay, per time or in a
in a
year?
lifetime.
I'm just making sure that
Sadly,
the audience understands our
so,
definition. Yeah.
right, so many of these can be long lasting
Hmm.
and particularly for human papillomavirus, can show up much later in life.
Hmm.
And I always get in a room with someone with HPV or herpes virus, and they want to know, well, how
When
did I get
when
this?
did it happen?
When did this happen? Tell me the time. And I was like, well, don't go kill anybody because I can't tell you exactly. It could
Hmm.
have been a long time and may not have shown up yet, may not have
Hmm.
shown cervical cancer from HPV dysplasia, precancerous cells until much later.
Hmm.
And so, sadly, the spread is from having more than one sexual partner. It's like you have heard people say, you not only have sex with this partner, but you also have had sex with every partner they've had.
They've had, right.
So, just by common sense,
Hmm.
your risk is going to go up by the more partners you
You
have,
have,
the more
right.
exposures you have. And as far as why do we have this and what can we do to prevent it, we also have what we've mentioned earlier, a higher rate of teenage pregnancy, a higher rate of sexual activity in young people, a higher rate of casual sex, in that sense of um, almost like a hobby. I would say I see that where they don't the young
Mm-hmm.
don't take it seriously. They don't understand the ramifications of their decision making,
Right.
and it all goes back to the breakdown of the family.
Family.
And do we not have that more in our rural
Mm-hmm.
South in these areas that should be the Bible Belt, but they're really having a breakdown of the family, the
Yeah.
absent parents,
There's actually more divorce in the South than in the North. It's just the North don't get married as much, but there's more. Well, that's what the statistics say. There's more divorce cases in the South, so it's
right.
interesting. You know, as a physician, though, would you recommend other things they can do to prevent? If this young lady in your office says, "I don't care about the abstinence stuff. I just want to be safe." What would you do for that patient? She doesn't want to get HPV, chlamydia, gonorrhea. What would you recommend?
Well, we have to recommend safe practices like
Right.
use of condoms to protect yourself. And I do talk about that.
Mm-hmm.
Sometimes moms bring young patients in to prevent pregnancy, but we also have the conversation about sexually transmitted diseases and protecting yourself, that you understand that birth control does not stop sexually transmitted diseases. It will prevent pregnancy,
Mm-hmm.
but you have to also use condoms and use protection to prevent that.
Do you use a lot of the vaccines, the HPV
We
vaccines,
use
the
the HPV
Gardasil, to help
vaccines
prevent
to help
possible?
prevent that. We
Yeah.
talk about that.
So that's another thing you can do, especially in your teenagers,
Right.
to help them stay
And
away
a
from that.
lot of parents feel like that, would be excusing activity or encouraging activity as far as the HPV vaccine. But I say, 50% of marriages end in divorce. They might actually get married one day to someone who has been married before. And why not protect them and prevent this HPV
That's
infection? You
true.
don't know what life situations will come later. So,
In Mississippi, they'll say, I reject it. That's the classic refrain from the patient. I reject it. They don't want to consider the possibility.
hmm
I've gotten used to that in my patients. I
yes,
reject
I
that.
reject that.
They believe for the best and only the best. Tell me a little bit about work-life balance as an OBGYN, because my viewers are watching and they're like, I mean, how do you maintain a family and play your role as a mom with working 80 hours a week or 70 hours a week? I mean, you're on call, you do. So give us a little background. So a lot of females in our generation want to do the office hours only
hmm
because they have those work-life issues.
True.
So a lot of my colleagues want to be, I wouldn't say part-time, but they don't want to take calls and
hmm
because they want to do other things. So how does an OBGYN who still delivers babies, and are there options for an OBGYN who wants to maintain a certain work-life balance? Think about a young girl who wants to go into OB and she's saying, I don't want to do it because of the excess calls and
hmm
chance of being called at 2 a.m. to deliver a baby that may not come out till 7 a.m.
and that happens. That does happen.
So how
Uh,
would you tell that young girl that it's not as bad as you think? So like
well,
you've done it.
thankfully, I have a good group. So the partnership with your partners and sharing call helps a tremendous amount. So that when you have those calls, yes, they can be difficult, but you can also pass the baton and get sleep the next night. So we share call. We have weekends that we have off, and we have time with our family, and scheduled vacations and all. With that being said, it is a hard specialty, very demanding, early in the morning, late at night, delivering babies, and I, I always want to be realistic about it too and talk about your spouse, like we have said. you have to have someone who is willing to be flexible with you. And
Mm,
so there are always give and take work balance issues and interrelational issues with your family to make it work. There are some, you know, we're not perfect. There are things that I've missed, and but I do try to be at my kids' activities and try to block out time. And it really does help to have a group large enough where you can share
share
call.
call.
Hmm.
And have a partner who's also
Understanding,
flexible and
yes.
understanding.
Hmm.
Wow. Just give us your opinion on birth control as a Christian physician. Many of my viewers are Christians
Hmm.
and different, let me use the word faith, let me use the word spectrums of faith.
Sure.
Some tell you it's against the Bible to use birth control. Those are the extreme. Then some tell you on the other extreme that it's against the Bible to do even assisted reproductive technology, to use insemination or IVF. And a lot of my viewers think, wow, she's a Christian, so she knows the right answer. So let's ask Dr. Travelstead. So they want me to ask you, what's your opinion? Should a Christian use birth control? Should a Christian use assisted reproductive technology?
Well, I, of course, that is a spiritual issue that you would wrestle with God and your own beliefs, and so I can't say a prescriptive for everyone and what you think is right. I personally feel that God is the great physician. Jesus is our great physician. He gives us medical knowledge, and just like we give insulin to diabetics, there are medicines that we use, and that doesn't mean we don't seek His counsel and prayer about our family size
Mm-hmm.
and about how we want to have children. And I think every child that is born is not a mistake. It's a
Mm-hmm.
perfect plan of God, and whether they're conceived in a difficult, unwanted situation or whether they're conceived with much prayer and angst and in vitro technology help, I believe they're all perfect gifts of the Lord. And I also believe your family size, that God can work in miraculous ways. Plenty of my patients have been pregnant on birth control, and plenty have gone all the way through in vitro and had difficult times getting pregnant. So I personally feel that God can work in the way in which we live, just like He did in biblical times,
Mm-hmm.
uh, when women were barren for a certain time and place, even to bring about uh, the John the Baptist who pointed the way to Jesus Christ and Elizabeth, uh, and a small virgin birth and a small lady Mary, a young lady Mary. Um, I think that God can work through our situations and
Awesome.
our technology.
So let's talk
And
about different contraceptives. So
mm-hmm,
the reason why I bring this up because some people have, there was a lawsuit against the federal government about, I think, Plan B. A
mm-hmm,
Christian organization, Hobby Lobby, took the federal government to court because they wanted them to use Plan B on,
mm-hmm.
and they were against it. So they weren't against regular contraception, but they were against Plan B. So for you, is Plan B a contraceptive or is not a contraceptive?
Uh, the way Plan B works, it's a progesterone which delays ovulation. So I don't personally feel like you're affecting the life of a child in delaying ovulation. It's preconception, so I
Okay,
don't have a problem with
with that.
that. It's the embryo itself,
Uh,
and you're preventing, that kind
so
of.
other ways of contraception include, I know we have the depot shot, the
Hmm.
Nexplanon, the IUD, the
Right.
pills, the patch, anything,
Vaginal ring that
the
works kind of like the
ring,
birth control pill.
and
There's even pH related vaginal gels which are spermicidal.
okay,
So,
and we can as Christians utilize that. You're not a proponent of replenish and multiply, right?
right.
Like
Right.
have 20 kids because you can.
Because you can, right? I
So you
think
believe in some
I believe in
control,
yes,
if you can.
and I think that's what we do in all of our lives. We are created in the image of God, and God gives us a brain and decision making ability, and we consult with Him all the time, whether it's a career, a place we live, a ministry that we do, and I think that God convicts you about
Okay.
what you
What you want to do,
should do.
right?
Hmm.
So did you and your husband have that conversation? How many kids you
Sure,
want
we
to have?
did.
A lot of Christians don't. They just say, let the Lord decide,
No, no,
and they
no.
end up with 9 kids, and it's
And
kind of
if you
difficult.
look at the scriptures, did God give you a prescriptive in the scriptures? I feel like sometimes we confine the Lord to certain right and wrong, which, He dealt with people where they were.
Right. I mean, Jacob had 12, 14. I mean, people can reference,
That was a different time, though, right?
they can go back and reference some people in the Bible. So we've been talking with Dr. Meredith Travelstead. We're going to finish up our conversation next week. She's been sharing with us faith, family, fortune, 21 years as an obstetrician in the Jackson area, 27 years married, a mother of 4. She lost one pregnancy, which she still considers as one of her
Yes.
children,
Hmm.
and successful Christian leader in the community and a female leader at that. And when we come back, we're going to finish up talking about her, what her perspectives on abortion and some of the new developments that have come up, Roe versus Wade, and how, as a Christian obstetrician, she walks that path that is a little treacherous for people to walk in our generation. I just want to invite you to look at our new book. It's on Amazon.com. It's on Barnes and Noble. It's called AI Assertive Initiative. Um, this is a copy for Dr. Meredith Travis and her husband, but I just wanted to show you a copy of it. You can buy it online. You can look at my website, faithandpower.online, and get a copy as well. If you want to reach out to us, please, we want to hear from you. Write to us, ritapraise1@gmail.com. You can write to us at P.O. Box 550 71294. And we'll be back in Monroe for our last Friday Holy Ghost night. It's February the 20, I believe it's the 24th. It's the last Friday of the month, and it's going to be at the Oyo Hotel on Martin Luther King Drive, 11 p.m. to 4 a.m. The theme is Great Glory. Look forward to seeing you there. God bless you. Jesus is Lord. Amen.
Amen.